Good afternoon, everyone, and welcome to our seminar, Children's Rights and Drug Policies, Navigating the Intersection and Evaluating the Impact. I'm Gisela Hansen, in charge of international relations in DNOA, and I am deeply honored to be your host today. First of all, I would like to thank everyone for attending and joining our conversation today. Your participation is very, very valuable for us. Thank you very much for that. Above all, a heartfelt thank you to our guest panelists for their time and dedication and for sharing their knowledge with us today. Networking and spaces for sharing are totally essential for strengthening us as a civil society. This seminar will be held in both Spanish and English, and we will have simultaneous interpretation. To access it, simply activate the interpretation option and select whether you would like to listen to each speaker in the original language, or maybe listen to the whole seminar in Spanish or in English. You can choose the channel that suits best for you. And before we begin, I would like to encourage everyone to introduce themselves in the chat by sharing your name, organization, and country if you feel like. That would be awesome. And this seminar will be recorded. And for anyone who would like a certificate of participation, feel free to request one using the link provided in the chat box. So, este seminario, I'm going to switch to Spanish now. Este seminario va a ser llevado a cabo en español y en inglés. Y vamos a contar con
We
traducción
will be
simultánea.
holding this
Para
event
acceder a la misma,
in
simplemente
Spanish and
tienes que activar
English
la
with
opción
simultaneous
del canal de
translation, and you
interpretación
just have
y
to activate
seleccionar aquella
the
opción en la que se
interpreting
encuentren
or
más cómodos
interpretation
y
channel
cómodas,
and
sea si
choose
quieren
the language
escuchar
you
a
feel
los
most
panelistas
comfortable in.
en su lengua
If you'd rather
original,
listen to
o
the
por el
panelists in
contrario,
their
escuchar
original
todo el
language
seminario
or
o
listen
en
to the
español o
entire
en inglés.
seminar in
Y
Spanish
antes de
or
comenzar,
English,
queremos
you may
animar
do
a toda la
so.
audiencia
We want to
a
encourage everyone
presentarse a sí
to
mismos, a
introduce themselves in
compartir
the
pues eso,
chat
su nombre,
and
organización
name
y
their
país, y así lo desean
organization.
por medio del chat. Y
You
este
could do
seminario
so
va a
through
ser
the chat.
grabado
We
para
will be
aquellas personas que
recording the
quieran un
seminar
certificado de
for
participación.
those of us who
Por favor, siéntanse
want
libres de solicitar uno utilizando el link que les
certificate of
vamos
participation.
a
Feel free to
proveer a
request
continuación.
one using the link provided in the chat box.
Quiero comenzar recordando que el 20 de noviembre conmemoramos el Día Internacional de los Derechos de la Infancia. Una fecha en la que renovamos nuestro compromiso con la defensa de los derechos de la infancia.
I would like to begin by reminding you that on November 20th,
Desde
we
DNOA
commemorate International
Internacional
Children's Rights
trabajamos
Day, a
continuamente
date
para
on which we
visibilizar y
renew our
promover estos
commitment to the
derechos,
defense of
motivo por
children's
el cual
rights in
este
all their
mes
breadth. From DNOVA
desarrollaremos dos
International,
seminarios online
we want to
dedicados a la
continuously
infancia
make
y a sus
visible and promote
derechos
these
en
rights, which is
diferentes
why this
ámbitos.
month we'll develop two
Hoy,
online
día
seminars
13, queremos
dedicated to
dirigir la
children and their
atención hacia
rights in
una
different
cuestión
areas.
que ha
Today,
permanecido en
on the
gran
13th,
medida
we want to draw attention to
invisibilizada:
an issue that has
los
remained
derechos
largely
de la
invisible:
infancia en el ámbito de las
children's rights
adicciones.
in the field of addictions.
Lamentablemente,
Unfortunately, this
esta
issue
temática ha
has
sido abordada
historically been
históricamente
approached
desde una
from an
perspectiva
adult-centric
adultocéntrica,
perspective,
dejando de lado las necesidades
leaving
específicas
aside
de
the
los niños
specific
y
needs
niñas
of
en relación
children
con los
in relation
desafíos
to the challenges
asociados al uso
associated with
problemático de
problematic
sustancias y las
substance use and
adicciones.
addictions.
Hoy queremos poner el
Today,
foco en la
we want to
urgencia de
focus
que
on
las
the
políticas
urgency
de
for
drogas
drug
incorporen una
policies
perspectiva
to
de derechos de
incorporate a
infancia,
children's rights
incluyendo
perspective,
una reflexión sobre el
including a
estigma que
reflection on
rodea
the
este
stigma
ámbito y
surrounding
las
this area
vulneraciones de
and the
derechos en
violations of
todos sus
rights
sentidos.
in every
Este
sense of the
seminario
word.
abordará dos
This
realidades
seminar will
específicas en
address
las que
two specific
intersectan
realities where
infancia,
children,
derechos y
rights,
políticas
and
de
drug
drogas.
policies
Por un lado,
intersect.
vamos a analizar
On
el
one hand,
impacto del
we'll
consumo de
analyze the
sustancias en la
impact of
salud y el
substance
bienestar
use on the
de los
health
hijos
and
e hijas de
well-being
personas
of
que
children,
pueden
of
enfrentarse a
people facing
desafíos
addiction
con la adicción.
challenges.
Y por otro lado,
On
vamos a
the other,
reflexionar sobre la
we'll
situación de
reflect on the
niños,
situation of
niñas y
children and young
jóvenes con
people with
consumos
problematic
problemáticos que
consumption
necesitan
who need therapeutic
acompañamientos
accompaniment
terapéuticos
adapted
adaptados a
to
su etapa
their
vital y necesidades
vital stage,
específicas.
their life stage, and specific
Como hemos
needs.
comentado, tenemos el honor
As
de
already
contar con
mentioned,
personas
we're honored
expertas
to
en
have
materia de
experts in the field
diferentes
from
partes del
different parts
mundo,
of the world
quienes nos van a
who will share with
compartir
us
cómo
how they
cómo
approach
abordan
the
ellos y ellas la
complexity
complejidad de
of
esta
this
intersección
intersection from
desde la sociedad
civil
civil, trabajando en
society,
primera
working
línea
on the front line
y con
and
intervención
with direct
directa en las
intervention with
comunidades
the
afectadas.
affected communities.
Nos van a brindar
They'll provide
recomendaciones,
us
lecciones
with
aprendidas y líneas de
recommendations,
trabajo
lesson learned,
futuras
and
para
future lines of
fortalecer la
work
evidencia
to
y el
strengthen
trabajo en
advocacy and
alianza.
partnership work.
Les recomendamos que si quieren
We recommend
compartir
that if you
preguntas
want
para que los
to
podamos
share any
desplazar en la parte
questions
final del seminario,
for us to
pensamientos y
ask our
reflexiones,
speakers
por
at the
favor,
end of the
siéntanse libres
session
como
or any
audiencia para
comments, feel free to
compartirlas
do so
en la cajita del
in
chat.
the chat.
Y ahora vamos a pasar,
And
sin más
now,
dilación, a la presentación de
without
las panelistas,
further
bueno, a la
ado,
presentación de nuestras
we
personas
will
expertas invitadas hoy
introduce our
y a sus
panelists
intervenciones.
and get
So without further delay, we turn it over to our speakers. And once again, we thank them for joining us in this important space for dialogue. To kick off this first segment, I am pleased to introduce a highly esteemed professional and compassionate advocate who makes a difference every day and brings outstanding expertise to our table today. Agnes Chin is a proud first-generation Canadian, a mother of four, and a registered nurse focused on anti-oppressive and trauma-informed approaches to health and well-being. Using her lived experience with the criminalization of a parent's experiencing poverty and substance use challenge, she founded Stallings Community in 2021 to address systemic barriers to health equity for families. Her work as a peer and professional is rooted in transformative justice approach to care, allowing her to lead a movement that centers young people's experience with the stress and stigma of apparent substance use and contributes to international discourse on children's rights from a family-centered lens. Agnes, good morning, and thank you so much for being here with us today. We are looking forward to everything you have to share. So the floor is yours.
Thank you so much, Gisela, for that introduction, and to all of the DIANOVA team and all the other guest speakers for having me and hosting such an important conversation centered on children's rights and drug policies. And as you mentioned, this is a conversation that's really near and dear to me. Again, my name's Agnes Chen. My pronouns are she, her. I'm a registered nurse, mom of four, and the founder of Stallings Community. And so we're a not-for-profit organization with a really unique focus on strengthening that ecosystem of support around young people who are growing up with, again, what we call the stress and stigma of apparent substance use. And this vision was founded on my own lived experience growing up as a first-generation Canadian with immigrant parents, and witnessing not only the harm and discrimination towards them by the system and making meaning out of that, but also the barriers we experienced as children. And these barriers, as we know, and which brings all of us here today, still exist today. And so I'll just share a little bit about Stallings and how we got here. So we're a team of what I like to call passionate peers and fierce allies who are actively destigmatizing resources, relationships, and research that affects young people today. And so more specifically, as you can see on the screen there, we focus on three main areas: peer leadership, family and community capacity building, and research and knowledge equity. And so one, we develop peer leaders who are guiding and leading these discussions through advocacy and education, as well as building awareness and confidence in impacted young people through resource development and then our peer mentorship programming. Two, through community and family capacity building, so such as our trainings, workshops, and toolkits for professionals, but also for caregivers who are often inadvertently perpetuating stigma within that family environment. And then lastly, research and knowledge equity. So by ensuring that young people have access to relevant information, they can make meaning of their experiences, they can heal from trauma, and they can lead the development and dissemination of that information. All right, so what did we do? A little bit about how we got here. So we really married the science of adversity, of adverse childhood experiences, with our stories of stigma, which is often lacking within the literature, to really contextualize the experiences young people are having. And so we know in Canada and similarly around the world, it's about 1 in 5 young people who are growing up, again, with parental substance use challenges. This number can be as high as 1 in 3, right to 1 in 8, we see, depending on the geography. But as identified around the world through peer-reviewed literature, impacted youth are at double to triple the risk for poor mental health, substance use challenges, and suicide. And so, but when we dive into the research further, we see that a lot of it focuses on that immediate home environment and the dysfunction and harm of parents who use drugs without really considering the role that societal conditions play in the experience and health outcomes of youth. And this, of course, informs policy related to drug use, which is a lot of what we talk about today. And as you can see on the screen there, right, in one of our reports, by defining parental substance use as a household problem, does the literature omit the role that societal conditions play in the experiences and health outcomes of youth, unjustly perpetuating a stigma that blames parents and families? And so what we've identified is that current drug policies, the interpretation of children's rights, and then ultimately the support for youth mental health, it decontextualizes the youth experience and omits the barriers that many young people and their parents continue to face today, which means that young people, from what we hear, what we know as peers, leads to youth not being able to reach out for help because of fear of discrimination, fear of parental criminalization, or fear of family separation. I'm just going to share a short video.
I wish people would listen to the entire story and be more understanding and accepting, because people in these situations need people that care, not people that judge.
Stigma, amplifying the voices of children impacted by the stigma of a parent's addiction. Starling's community is ensuring youth impacted by the stress and stigma of a parent's addiction are offered hope and empowered to heal. As part of this effort, we conducted a survey to gain insight into the experiences of impacted youth and adults. We asked individuals how stressful they felt their childhood was because of a parent's substance use. 44.2% said extremely stressful, and 35.4% said stressful. They told us that as a youth, the experiences with a parent's addiction impacted their mental health, 96%, stress level, 95%, social life, 83%, and schoolwork, 67%.
The anger I had as a child wasn't my fault. I had no idea how to cope with it, why I felt this way, or why it was happening to me. I carried that anger with me for a long time.
As an adult, the experiences with a parent's addiction impacted their mental health, 89%, stress level, 75%, social life, 53%, and parenting, 25%. Individuals who did not reach out for mental health support as a youth explained why. 36% said shame, and 34% said stigma. Individuals who did not reach out for mental health support as an adult explained why. 28% said shame, and 22% said stigma.
It's hard to heal from something when there's so much shame. You feel as though you can't reach out and that nobody is there to help or care.
38% of youth disagreed or strongly disagreed that their parents were treated with dignity and respect by the healthcare and justice system.
I want society to understand the level of shame the entire family feels, the struggle of loving someone who hurts you but doesn't want to, how much criminalization hurts.
In Canada, approximately 1/6 of youth are impacted by the stress and stigma of a parent's addiction. This places youth at a substantially increased risk for suicide, mental illness, and addiction itself. We are on a mission to change that. Impacted youth told us what helped.
I don't want to be understood. I just want kids to know that they aren't alone.
Seeking help from a therapist or counselor.
Getting in touch with my Indigenous roots, being more connected with family.
Become an ally today, committed to ending the stigma of addictions so that youth can move forward with hope and healing.
All right, and so we really want to get to the root of the challenges young people are experiencing. We know that, yes, there's been a lot of research and the literature identifies that home environment can be stressful, but we also know that parents and young people can't seek out support because of stigma. And so by exposing these hard truths, sharing our stories, and leading the development of resources that are peer-led and peer-driven, we believe we can improve relationships, resilience, supports, and on the topic of children's rights, we can ensure that every child can experience their right to a healthy family and every family their right to support. Our website is there. Have a look. We have a peer library. We have our resources for professionals as well as for families. And please feel free to reach out with any questions. Thank you very much for your time and this opportunity.
Thank you very much, Agnes. Thank you very much for sticking to the time as well. And can we maybe share afterwards all the links and the information and the website through the chat box? There's a lot of people interested in that. So, I mean, we can use the chat box as well to share all the source of information around children's rights and overcoming stigma. So thank you, Agnes, for this, and to bring words like respect, dignity, and the voices of the people who are, affected by this situation, not just speaking for them. They are just having the word. So thank you very much for that. I'm pretty sure that there will be plenty of questions afterwards. So our second panelist is a professional committed to children's rights and the search for effective strategies in family intervention, carry out in a respectful, efficient, and non-stigmatizing manner. We are honored to have here today Rebecca Kleinert. Rebecca holds a degree in sociology and has over 10 years of experience in project management, specializing in European projects as a project coordinator at the LWL Coordination Office for Addiction Issues. She has played a pivotal role in developing and implementing initiatives aimed at supporting families dealing with addiction challenge in the last couple of years. Her expertise lies in coordinating interdisciplinary teams, strategic planning, facilitating co-creation processes, and developing training programs and practical approaches tailored for diverse professional setting in addiction prevention. Hi, Rebecca. Thank you very much for joining us to these seminars. And we are totally eager to listen all your knowledge and your thoughts. Thank you very much. The floor is yours.
Thank you, Gisela, for the kind introduction. I'm very honored to be able to present the work, my organization, the LWL in Germany, and our partners from the Euronet network, a European network for practical approaches in addiction prevention, we're able to do in the last 4 years in the Make the Difference projects. I also want to acknowledge, of course, the funding of the European Commission, without which we would not have the chance to do this work. So in these projects, we have worked together to support families with addiction issues with partners in 12 and later on in 9 different EU countries. And yeah, first of all, for our project group, we have defined 4 areas of action to support families with addiction issues, and in particular, the children. The first one was cooperation of services and structures, which are necessary to identify affected children early on. And for this, the services, of course, need the support of the local and regional policy and decision makers, which was a great challenge in some of our countries. The second area of action for us was qualifying professionals, and by that promoting the empathy of professionals, reducing stigma, and also increasing the security of action of professionals engaging with the families. The third area we defined for us was suitable support and help offers for the children. And the fourth area was awareness raising and advocacy. And for our project, we actually have prioritized the first one, cooperation and structures, and the second one, qualification. Not because these areas are more important than the others, but because this is where we as a network have the most experience and expertise. So briefly about the project. As I said, we were able to get EU funding for 2 projects. The first initiative was the Make the Difference project, which ran from 2021 to 2023. Where we prioritize child protection and protocols in addiction services, as well as the development of cooperation agreements between addiction services and child protection services. We also trained 42 professionals from addiction and child protection services in a joint seminar about issues concerning families with addiction issues, with the aim to promote their collaboration already in these in the training, and also already promote a discussion about attitude and empathy when working with these families. As results of this first project, we had in the end 12 binding cooperation agreements in 12 countries between these 2 services. We published a guide called Building Bridges of Support that was created to offer practical tools and recommendations for cooperation between addiction services and social services. And last but not least, our partners in 12 countries trained almost 2,000 additional professionals in their countries based on this first joint seminar that we organized in the project. In the second initiative, a smaller, much smaller follow-up project, an Erasmus Plus project, we focused specifically on the issue of qualification of professionals in various sectors, such as healthcare, education, social services, and child protection services. So we did not focus on addiction services in this project. We also prioritized involving the perspectives of the families by conducting interviews and online surveys in 9 partner countries. And in this project, which is currently still running until the end of the year, we developed a comprehensive curriculum for training these professionals. Okay, so as I said, we have collected experiences from families with addiction issues that have been incorporated into this curriculum. We received responses from 64 people, 33 of whom have a substance use disorder, 39 of whom have at least one parent with an addiction, and 41 of whom have children themselves. And as you can see in this graph in the center here, these 3 groups overlap considerably in this in our sample, with 14 people in the center who grew up with parents who use substances, who have an addiction themselves, and who also have children of their own. And what we gathered from these interviews and online surveys in these 9 countries are these points I'm mentioning here on the left. So what we said, okay, needs of those families were they need a comprehensive, family-centered, and non-stigmatizing support. Professionals need empathy and a humanistic perspective. So they need to see the whole person and not just the addiction. We definitely need more attention to and specific support for the children, for example, mental health and substance use prevention and early intervention for these children, as they have a high risk of developing mental health issues or substance use issues themselves. We need trauma-sensitive approaches for both parents and children. And the parents regularly mentioned that they need practical life skills, including parenting skills as well. Yeah, so on the right, you can see here a rough overview of this curriculum we then developed together with all our partners, and which incorporates the experience of these families. It has a modular structure, as you can see here, 7 modules. Yeah, the content is informed by the experience of the families, including insights on how stigma affects the children. So we made sure that the curriculum is grounded in the real needs of children and parents. Yeah, the modules include information on how addiction affects families, dynamics, risks, effects on the children, in the long term and short term. Of course, information about addiction, and then communication tools for working with families with addiction issues in Module 3. Module 4 focuses on working with the parents, engaging with the parents, addressing risks with them, but also supporting them and the issue of improving their parenting skills. Module 5 is all about supporting the children across various sectors, so healthcare, education, social services, all of them. Module 6 addresses the need for an integrated, family-centered approach and networking across services. And Module 7 we added because we also need healthy professionals in order to support those families. So we added a module on self-care and burnout prevention for professionals here. Yeah, so very brief overview about what we did. I'd like to conclude by announcing that this curriculum will be freely available as an open educational resource on December 3rd. We hope that we can disseminate this and implement it as wide as possible so that qualified professionals across all different sectors will be better equipped to support families with addiction issues. And finally, I would like to invite everyone to our online conference also on December 3rd, where we will have the opportunity to listen to a keynote speech by my co-speaker here, Agnes, and where we will be presenting the curriculum and also discussing ways to implement it. Yeah, all the information is here. I can also share it in the chat again afterwards. Yeah, thank you for your attention.
Thank you very much, Rebecca. So inspiring this presentation. And thank you very much for sharing all these resources. And again, we can share it through the chat box. And I encourage everyone to attend on the December 3rd to this conference with Rebecca and Agnes as well, to follow this conversation and very, very specific curriculum. I think we can zoom in a little bit more afterwards about what is non-stigmatizing intervention and what it means to have family-centered lens intervention, because maybe we have different conceptions around the world, and it could be very nice to hear from you afterwards. Thank you very much, Rebecca. Ahora vamos a continuar, voy a cambiar de idioma y vamos a continuar con nuestra tercera panelista para cerrar.
We're going to continue to close this first block focused on children. Our next panelist is a professional reference in Latin America in terms of gender perspective and children's rights in the field of social inclusion. And a very dear colleague. Valeria Frato holds a degree in psychopedagogy from the Universidad del Salvador, Argentina. She's director of institutional relations of Fundación Convivir, an entity that works from a rights promotion perspective, taking into account cultural and gender diversity. She supervises programs and territorial projects based on the community treatment methodology and participates in significant platforms in drug policies and rights such as the RAISSS Latin America, RIAD, ISUP Argentina, and others. Valeria, thank you very much for being here today. It's always a pleasure to listen to you, and we're all ears. Thank you. Go ahead.
Muchas gracias.
Thank you,
Bienvenidos
Gisela,
a todos
and
a todas.
welcome to one and all.
Especialmente a Dianova Internacional,
Thank
a
you,
Gisela
Dianova
Hansen.
Internacional
Creo que
and
es un
Gisela
evento
Hansen.
sumamente
This is a
importante
very
y
important
necesario
and necessary
de
event
poner en agenda a las infancias, en especial
to
en este año
put
que
children
estamos celebrando los 35 años de la
in the
Convención
focus,
Internacional.
especially as we
Por eso,
celebrate
obviamente,
Dianova's
agradecimiento a
35th
Dianova
anniversary.
por
So
esta
again,
invitación.
congratulations and thanks to
Desde
Dianova for
Fundación
inviting me.
Convivir, formo parte,
Fundación
como les decía
Convivir
Gisela, de la
is, as
acompañamiento
Gisela
a
said,
dispositivos de infancias en
works to
situación de alta
accompany
vulnerabilidad social.
children in situations of social
Por
vulnerability.
eso es que nos interesa
And
contar
that's
la
why we're
importancia de los espacios de
keen to
cuidados y de las redes
explain
comunitarias
how we
para
care for
reducir el impacto del
those
estrés y del
cases and a
estigma
network
en niños
to
y
reduce
niñas cuyos
stress and
padres
stigma
enfrentan desafíos
in
relacionados con el
children
consumo de sustancias.
who are facing challenges due to substance
Como
consumption.
introducción o
Just as an introduction,
para contextualizar, en la actualidad
and to
sabemos que las dinámicas
contextualize,
familiares están
in
profundamente influenciadas
Argentina, we know
por las
that family
condiciones
dynamics
socioeconómicas,
are very much
por un
influenced by
aumento
socioeconomic conditions
significativo
and
de
in a
niños y
significant
niñas que
increase
crecen en
in
contextos de
children
vulnerabilidad social,
growing up in
junto
situations
con
of social
familias que
vulnerability
están afectadas, entre
with
otras cosas, por el consumo de
families that are
sustancias.
affected
En
by
Argentina,
substance
algunos datos
use.
recientes de la
In
CIDRNAR, de la
Argentina,
Secretaría de Drogas de la
according to
Nación,
recent
resaltan este incremento,
data
generando
from the
preocupación
public
claramente
administration,
en
it
el adecuado
highlights this
cuidado
problem
de los
and
niños y de
the
las
concern
niñas
about
a
the
cargo
care
de
for
sus
children
cuidadores afectivos.
being cared for
Con lo cual,
by
esta
their parents
situación
in these
del
situations.
consumo
So a
problemático de
situation of a
sustancias en los
problematic
cuidadores parentales
substance abuse
comienza a ser
in
una problemática
among parents
necesaria a abordar
is
y a
beginning to
prestarle
be
atención
something that
especial.
requires a special and
Algunos
specific
datos
attention
significativos
in Argentina.
específicamente de
Some
Argentina es que
significant
casi la mitad de los
Argentine
niños y de las
data,
niñas
almost half
y de
of
los
children
adolescentes
and
viven en
adolescents
situación de
live
pobreza
in
e
a situation of
ingresos,
poverty
siendo una mayor proporción la de niños
due
en
to
situación de
income,
pobreza que la de
and there are
adultos. Esto
more
es muy
children
preocupante.
in poverty than
Esta
adults.
brecha se ha
This gap
incrementado aún
has
en las últimas
increased
décadas,
in recent decades.
lastimosamente. Por lo tanto, los niños de
Therefore,
padres con
the
consumos
children
problemáticos de
of parents
sustancias
with
no
problematic
solo van a
substance abuse
enfrentar el
problems
estrés
will
de
not
un
only face
entorno
the
inestable,
stress
como
of an
decían las
unstable
compañeras en
environment,
sus presentaciones
as we've heard
anteriores,
from our
sino
previous speakers,
también
but also
van a cargar con el peso del
they
estigma
will
social,
have
lo
to
que va a
bear the
afectar
social stigma
profundamente su
burden that will affect
desarrollo emocional
their
posterior.
emotional
Por lo
development
tanto,
later on.
todas aquellas intervenciones
Therefore,
tempranas
any
que
early
podamos
intervention
realizar,
that we can
el
carry
apoyo
out,
psicosocial,
any
pueden ser
psychosocial
claves
support
para construir
can be
resiliencia,
key
para reducir
to
el
build
impacto
their
del estrés
resilience,
y
to
para
reduce the
poder
impact of
romper
stress
con ese ciclo del
and
estigma.
break away with the cycle of stigma. And here, I think it's very interesting to think of how, from attachment theory and the relationship established between young children and their primary carers, mothers, fathers, or any other person of reference, and based on the observations carried out by John Bowlby, with a focus on observing and strengthening the relationship established between the primary caregiver and the child. According to this, children develop a sense of security when their primary caregivers are willing to listen and receptive to their. The child thinks that a reliable caregiver is a source of well-being. They feel secure, they can explore their environment, they can develop themselves in a healthy way and strengthen all of their potential. So with this attachment, what happens with attachment when the relationship between children and their caregivers is affected by their caregivers' substance abuse problems? And also considering that any human conditions is inherently vulnerable, this is even truer in childhood due to this dependence on another person to meet your needs and to constitute yourself as an autonomous being. Therefore, when these children are made vulnerable, they are vulnerable per se, but when they are made more vulnerable due to their living conditions, there is a double violation of their rights. Therefore, the risk factors will only increase. Being a child or adolescent in these contexts will require specific interventions. Adverse experiences when you don't have safe attachment. To the contrary, there's an anxious or avoidance-based attachment. These things lead the children to chronically activated stress systems, long-term effects on their physical and mental health, and they establish attachment strategies as a way to survive their unstable or insecure caregivers. As we've heard in the previous stigma and possible interventions to support these children, we believe, to speak about this, one of the opportunities are the child raising and giving spaces, children, areas for the special care of the first childhood, later years as well, that are conceived children and run by properly trained professionals who can accompany and sustain these childhoods, articulating synergies that are geared to guarantee the access to rights, providing and promoting opportunities for the maximum development of their skills, abilities for each child. The value of these caregiving spaces as key tools to protect vulnerable childhoods and violated childhoods, promoting shared responsibility, providing other forms of primary identification, other forms of containing adults, and facilitating healthy projects of healthy lives. So this is where, when there are contexts in which this is weakened or compromised, as can be a problem with substance use in adults, community networks take on greater importance, as they are conceived as informal social support structures, shared resource structures within a specific community. These emerge as fundamental players to provide safe spaces to families affected by substance abuse and contention for these children whose childhood rights have been violated. Some of our final thoughts are that it's fundamental to work with proposals that allow us to truly develop children's development with factors of protection, strategic actions, and contributing, intervening together with their effective caregivers to strengthen that bond, to re-bond to possible,
Son etapas fundamentales y únicas para
These are
favorecer el desarrollo
fundamental, unique
integral,
periods
proporcionando espacios de igualdad de oportunidades,
for
lo que
their
podamos hacer
psychosocial
en el
development.
periodo de infancia.
What we can
Si
do
bien no es
in childhood,
irreversible, es determinante
if
para
it's
el
not
resto de la vida futura. Por
irreversible,
lo
it is
tanto, las
determinant
acciones deben ser
for the rest
ya,
of their
ahora
lives.
y lo más
Therefore,
efectivas
interventions must
y
take place
eficientes
now and be
posible.
as effective and as efficient as
En este
possible.
sentido, el apoyo
Along these
comunitario y las
lines,
redes tienen un
community
papel
support
fundamental y
and networks
multifacético que
have a
apoya,
key,
incluye apoyo
multifaceted role,
emocional, material,
including
información,
emotional support,
orientación,
material support,
mediación en
guidance,
la resolución de
counseling,
conflictos pacíficamente.
mediation, and peaceful
Por lo
conflict
tanto,
solving.
proponemos un modelo
Therefore,
de
we are
corresponsabilidad
proposing a
social,
model
de
of social
compromiso social
co-responsibility,
frente a las
of social
infancias,
commitment
respetando sus derechos
vis-a-vis childhood,
conforme a la Convención Internacional de
respecting their
Derechos de
rights
Niños,
according
Niñas y
to the International
Adolescentes
Convention
de
on
1989,
Children Rights of
cuyo
1989,
enfoque considera al niño como
whose
sujeto
focus
de
considers
derechos y
children
prioriza
as
el
a
interés
subject
superior
of
de las
rights,
víctimas.
a subject with rights.
Muchas
And
gracias
unfortunately, we have
entonces
lost
por el
the signal.
espacio.
Hello?
Les dejo un
Muchas-
saludo y la página web que voy a ubicar en el chat.
Perfecto.
Gracias.
Muchas gracias, Valeria. Muchas gracias, sobre todo por contextualizarnos también la situación en Argentina actual, estos tremendos porcentajes de pobreza que comentabas y por poner en el foco también cómo la pobreza es un eje determinante para la salud y el
Yes,
desarrollo
indeed.
y cómo las intervenciones, ¿no? Desde un
Poverty
punto de vista
does
clasista, colonialista,
have
etcétera,
a
pueden
very important
revictimizar y reproducir un montón de
role to
cosas. Entonces,
play
quizás podemos
in
profundizar
stigma
un poquito en
and
este sentido
vulnerability.
y creo que la audiencia también
And
está haciendo preguntas en
perhaps
esta
we
línea.
can
Así
speak
que
more along
gracias,
these lines. And I
Valeria,
think there are
y
many
luego
questions
retomamos.
among the audience. Thank you for that, Valeria. We will
To
get
open
back
our
to this
next
topic later
session,
on.
our next part, our first part was focused on children whose parents might be facing challenges regarding the drug use or addiction. And our second part is focused on children and young people that may face challenges related to substance use. We are honored to present Dr. Rajesh Kumar, a leading professional in addiction intervention and the rights of children and women in India. We are proud to have SPIM as a member of the ANOVA International, where Dr. Rajesh serves as executive director. He is also the director of ISUP India and has dedicated 38 years to drug demand reduction, that's a whole life, prevention and recovery support. Dr. Kumar has received 3 prestigious awards from the President of India in 1989, 2014, and 2016 for SPIM exceptional contribution to uplifting marginalized community. Dr. Rajesh Kumar, thank you very much for being today with us and sharing all your expertise related to the residential intervention with young girls, finding the perfect balance from the gender approach and children's rights lens. We are eager to hear you, and I'm going to share the screen.
Thank you, Gisela, and I'm grateful to DINOVA for the opportunity. Let me just share 1 or 2 minutes about the situation of India. See, on the eastern side of India, we have 3 countries called Myanmar, Laos, and Thailand. So these are the 3 countries, those who have been, is called Golden Triangle. So we receive large number of consignments from these 3 countries. Earlier, it used to be opiate. Now it is all amphetamine stimulants, ATS. And on our western side, we have 3 countries, Pakistan, Afghanistan, and Iran, from where we get usually heroin. But again, in last 2 years, it has shifted. Afghanistan, poppy cultivation has gone down by almost 80 to 90%, but they have started now producing methamphetamine, and which is equally very, very dangerous. And the cost of production of producing methamphetamine in Afghanistan is like 30% or only 40% of the cost of production, whether it is in Mexico or any part of the world. So this is the background from where we are talking. And as you are aware, India is one of the most populous country in the world. And I'm talking about the age group of between 10 and 18, which is around 30 million population of young population. So if you see the next slide, a study was conducted by Government of India in 2018, which was published in 2019, which says that 2.1% of Indian children, and if you look at that number, 30 million, from 30 million, if 2.1% is a huge number. And before this study, people had no clue, no idea that the kids are also using drug. Of course, SPYM has been advocating with Government of India, with parliamentarians, with judges, with law enforcement agencies, that this is a major problem and we have to look at it. So thanks to this study, and SPYM also participated in this study, and we conducted almost in 8 big states of the country, like 40% of India's population states. That study was conducted by SPYM, of course, for Government of India under the Ministry of Social Justice and Ministry of Health. Next slide, because I have less time, so I want to skip some of the slides. And look at this number. This is all about the dependency. If more than 100,000 kids are dependent on opiates, then this is something very serious. And our organization, SPY, which we run 3 treatment centers in Delhi, and till now these are the only 3 centers for the children in the whole of the country. There are some small efforts, but not very systematic, not very based on science and evidence. So these 3 centers, out of these 3, 1 center we run for the children, those who are in conflict with law. 2 years back, when we had World Therapeutic Community participants in New Delhi, which was hosted by SPYM and WFTC and ISEP India. So around 80 countries from all over the world, they came and visited that center, and they all appreciated the effort. So, and second center is for the children, those who are in need and care and protection. And the third is exclusively for girls. And the most challenging is to invest in the girls, those who are using drug, because neither they are on radar of anyone. If the children themselves are not on radar of policymakers and the bureaucrats and larger population. So think about a tiny population, those who are girls and using drug. And you can see the students, this study was conducted only last year. 50% children said that they have used drug in last 1 year. And in ever use 15%. Past year they used 10%, and past month 7%. Now, when I say 7%, 7% is a very serious number, because it means that they have been using and they are using it, and the frequency could be very high. Next. Since I'm going to focus mostly on girls center. See what SPYM has been doing over a period of time, that we develop models for the country. And in last 38, 39 years, what we have done is we have developed only models. A model for prevention, model for early intervention, peer-led intervention, treatment centers. So most of the models have been accepted by Government of India. The last slide is on our Navchetna model. Similarly, the peer-to-peer, around 300 districts have been Government of India has adopted 300 districts, and one district population is between 2 to 3 million. So these are fairly large, big districts. So their peer-to-peer interventions are taking place. Now the problem is the special focus has to be on girls, because most of the girls, they do not initiate drug use on their own, whether it is because of their partners, or because of the local influence, or because of the people in the community, they introduce it to them. Initially, they have no idea what they are doing, and gradually they are pushed into sex work. They are pushed in sex work. They are being trafficked. They are being sold and bought. So it is very challenging, and due to stigma, neither family comes forward to inform that my daughter or a family member of my family has started using or experiment drug with women, female member of the family. So that is a big barrier. And India is traditionally a family-based society, where the family prestige, family, the pride is very important. So in this difficult situation, what we have been trying to do is addressing a stigma. We are helping families that if you will not speak, how we are going to help you and your family. Next slide. So this already I have shared. So next. So what we have done is over a period of time, because our treatment center for female, we started in 2017 with literally no idea, because the treating adult was very easy. We have a lot of adult treatment centers in different settings. We have been running before that 2 children's center, but we had no clue that when the girl will come, how they will come. So most of the girls initially they came with one child, one child in lap and one in womb. So and both the kids or one child was not of this girl's choice. It was because she was either raped or she was pushed in sex work or she was bought and sold and under the drug, the gang rapes. So she had no interest to protect and save this child. So our problem was how to protect this child and how to protect this another child who is a mother of this child. So because of all this, it was a very challenging, and over a period of time now, last 6-7 years, we have learned, and it has become much easier for us. We have developed standard operating procedures. We have developed mental health assessment system. We have also tied up with one of India's the largest mental health institute in the country. So we are developing again. But again, this is still on drawing board. Next, please. So this is the center I have been talking about it. Most of the girls, those who come to us, unfortunately, they are also HIV positive. They are hepatitis C positive. So our work is not only help them to recover from addiction, help them to address their behavioral issues, help them to the mental health issues. Our challenge and also taking care of their kids. Our challenges are also linking them with the legal services, because under 18, there are a lot of issues which needs to be addressed legally. Since they are HIV positive, so the first the test of HIV, then help them to link with the ART services for HIV treatment, hepatitis C treatment, and skill building, helping them to reintegrate back in the society. Family is not ready to accept this child back. So it is not so easy. But over a period of time, I told you that we have learned these the nuances how to address this. Next, please. So this is a glimpse. We can't show you the face as per the international and Indian law. So these are the sessions all conducted by girls themselves. So whatever we learned from this peer-to-peer, that is now being implemented in the schools also. And this is the photograph of that particular center. Next, please. The lesson learned from rehabilitation center, that this is again just one. We need at least in all the big metro cities, at least one. So if the services are there, then only people will approach centers and they will start sending the family members for the treatment. I told you, there are a lot of health challenges. There are the barriers. If we take them to a normal hospital, they first smile, then they giggle, and they say that this is just 12-year girl, how she started using drug. She must be coming from the bad background. What about their parents? So there's so much stigma, and to address these stigma, it is very challenging. So fortunately, I told you that we have tied up with some of the hospitals where these girls are sent, but that is possible only in Delhi. But when we are planning or we are advocating with Government of India to start it, it will be very challenging for them. Next, please. These are already I have shared with you. No, one. Social media, please go back. In social media campaign, I request Dynova to help us, because a large number of girls, they are not talking, they are not sharing, they are not discussing, and they are hiding it. During COVID, we came to know from various sources because the family members approached us that can you help us. So this is one thing which I want you and the partners, those who are right now currently watching and or as a resource person, to help us how to launch a big campaign in India and through social media. So this is one thing which I'm looking from this webinar from all of you. Next, please. This is a module which we have developed, and this module is fund-based. There are 2 modules of part of it. One is for class 6, 7, 8. It's all life skill based, and other is 9, 10, 11. Again, it's all fun. This module, we have already started it with Government of India and all the states of India. They're part of it. We are training around 1 million teachers, and in next 2 years' time, we will be reaching out to around 50 million children, those who are vulnerable. And for this, we have developed app. Schools have started approaching us with the app if they need any support, either mental health or substance use issues with the children. And we have started addressing those, and we are also transferring the skills to the various states and the local civil society organization. And the second is a peer-led intervention. This is the program. This is a 120 hours program, and every peer is paid, say, around $1.20. They have to conduct 2-hour session, again game-based, and this is very popular among the vulnerable population, the kids coming from the vulnerable population and vulnerable areas. Thank you.
Thank you. Thank you very much for sharing all this knowledge and lesson learned. I'm pretty sure that everyone is really shocked about the young age of girls in treatment settings, and you said a lot of interesting things like the need of trauma-informed counseling, mental health counseling as well. Well, thank you very much for this, and I hope we can recap a little bit more after in the Q&A time. Thank you, Rajesh. Okay, let me just one moment because I'm sharing too many screens at the same time. Thank you very much. Now I'm going to switch to Spanish. Nuestra última presentación.
Our last presentation for the second part will be given by Mario del Rio Bolance, a professional committed to children's rights and an expert in daily therapeutic intervention. Mario del Rio Bolance graduated in social education from the University of Granada, specialized in working with minors with behavioral problems and addictions and socio-educational intervention with families and children. Mario represents the EMED Foundation, which is a reference entity in Spain in the areas of addiction treatment, protection, and welfare of children and migration. Mario is currently responsible for the area of minors of the EMED Foundation, coordinating teams from the care and empowerment of personal and professional skills, and he will explain to us the enormous work done by the EMED Foundation and its wonderful professional team in the residential area of addictions with young people.
Buenas tardes, Mario.
Good afternoon, Mario.
En la cámara. Tienes la cámara
We can't see you on camera. Is your camera on?
Buenas tardes, Gisela.
Good afternoon, Gisela.
Muchas gracias, Gisela, por la
presentación. Thank you, Gisela, for that introduction.
And
thanks, Dianova,
for
creating and contributing to these enriching spaces for everyone. First of all, let me present our foundation for minors. Our foundation has 3 resources, 3 minor protection centers, 2 for minors between 12 and 17, 2 are autonomous, and another is in another autonomous community within Spain. Within the foundation, those 3 facilities, we can say the following. The profile of our young people with behavior problems and addiction problems. Within the behavior problems, the addiction is common to over 80% of our young people. Over 80% come in with addiction problems. It's curious to see how there's an interrelation that come from more excluded parts of the society, a bit like what Valeria said, from the more underprivileged parts of society, and that relationship between the lack of resources and addiction problems is very interesting. Our team is made up of social educators and psychologists. I'll speak a bit more about the direct intervention that we do at the facilities. And to begin, it's very important to establish a therapeutic bond,
los menores no
a
entiendan
therapeutic link,
que
and
el fin
an
nuestro,
affection link
desde que
with
ingresan
the
en
young
nuestros
people,
recursos de manera involuntaria,
because
es la prohibición o el control
they
externo, sino
come
que se
voluntarily
vaya
to
generando una
our
motivación
centers,
intrínseca para el
and there's
autocuidado
an
de
intrinsic motivation
su
for them
salud, tanto
to
física
care
como
for their
biológica.
own mental and
Y uno de los
biological
principales objetivos es la
health.
creación
One of the
de
main
la
goals
conciencia que
is to raise
existe,
awareness among them
existiendo un abuso y una
that
problemática de
there
adicción
is
que le
abuse
repercute
and an addiction
tanto,
problem that's having an
tanto al
impact
menor
on them
como a
as
su
a
entorno y
minor,
a su familia,
their environment, and their
haciéndole ver los
families
prejuicios del consumo.
due to the
Esto se
damages
realiza
caused
a partir de un
by
balance
substance abuse.
decisional por parte de él,
This
donde se
is
ven
done
junto a los
within a
profesionales los pros y los
decision-making
contras
model
y
by
ahondando en ese
themselves,
aspecto,
where they
así
see the
como
pros and
valorando
cons of
el
the
estadio del
situation
cambio en el que se encuentran.
and evaluate the possibilities for change
Para
within the
nosotros es
situation
vital
they're
en
in.
el trabajo desde
For
la
us, it's very
identificación
important in our
y la
work of
gestión
identification
emocional de
and
estos chicos y de estas chicas,
emotional
ya que
management of
suele ser una
these
de las carencias
young
en este
people.
tipo de menores,
That's one of the
tanto
things that
previo
they
del
lack
consumo como tras la
prior to
abstinencia,
their drug consumption and
normalmente siendo utilizadas
after
las conductas adictivas
abstinence
como un
begins.
factor
Usually,
evitativo
their
de su
conduct
realidad, con
is
sufrimiento
a form
y
of
emociones
avoidance
complejas.
from their reality and complex
Asimismo,
emotions.
si se produce la abstinencia, existe una conciencia y una
And
motivación
if
al cambio, se
abstinence
puede
does come
ahondar
about and
realmente en el
change comes about in
origen del
their
consumo,
attitude,
que puede que sea traumático
we
y
can address
precipitado por alguna
the
circunstancia
origins
puntual.
of the substance abuse that may be traumatic.
Además, pues diariamente, al ser
And on a
centros
daily
residenciales,
basis, in that
diariamente
residential
vamos haciendo
center,
un trabajo
we work
que se encarga un poco más del área educativa,
more
pues
on the educational side
de una dotación de herramientas de
with
posición
resources
de límites, porque la realidad
of
es que
setting
nuestros chicos y
boundaries,
nuestras chicas están un tiempo
because
determinado en
our
nuestro
young
centro
people spend a certain
y en
period of
muchas
time at our
ocasiones
center.
vuelven a sus entornos,
Oftentimes they go back to their home environments,
y una gestión del ocio y tiempo libre
managing their leisure
dándole
time and
alternativas
free
mucho más
time,
sanas
giving
de lo
them
que vienen una
healthier
vez en su ingreso.
alternatives that once they are
Basándonos un poquito
in
más
our
en los
program.
retos que nos vamos encontrando
Looking
día a
not to the
día
challenges that we find day to
centro y
day
el
in
enfoque
our center
reivindicativo,
and what we
no
would like to
entendemos nuestra intervención
claim in the future.
sin que haya
Our
una sinergia y
intervention can't be
una red
understood without a synergy,
comunitaria de
without a
todos
community
los
network
servicios
of
sociosanitarios,
all
educativos y
the social and
sociales
healthcare
dentro de la
resources,
provincia
educational
o dentro
resources,
de la
social
autonomía o a nivel
support
nacional.
resources
Por lo
at the
tanto, es
provincial, autonomous
imprescindible que las
community, or
administraciones
national
públicas
levels.
doten
Therefore,
de
it's essential that
a estos
the public
recursos
administration
sociosanitarios
provides
de recursos
these social and
personales,
healthcare
materiales y
resources,
económicos.
personal resources,
Aquí en
tangible and
Andalucía
economic
contamos
resources.
con un
Here in
servicio
Andalusia,
dentro
there is
del
a
eje
service
sanitario andaluz, que es el
within
CPD, que es
the
un centro
Andalusian healthcare system.
provincial de
It's a
drogodependientes, que ya el
provincial
nombre
drug
es
dependency
bastante
center,
estigmatizante, a mí no me gusta
and the
llamarlo
name
así,
itself is
prefiero llamarlo un centro
stigmatizing.
provincial
I
para
prefer to
personas con
call it
problemas
a provincial
de
center for
adicción.
people with addiction problems.
Por lo tanto, este servicio es muy interesante, pero claro, debe de
That's a
haber un
very interesting
compromiso por parte
service,
de las
but there
administraciones
should be a
públicas
commitment from
de que
public
haya una inversión
administrations
y una
for
dotación
there
de
to be
recursos
an
económicos.
investment and endowment of economic resources
Como
as well.
segundo reto, como segundo enfoque
A second
reivindicativo,
challenge, another thing we'd like to claim
como he explicado antes,
and ask
los
for,
chicos
as I
están
was
un
saying
tiempo
before,
determinado en nuestro
these young
recurso. Entonces, uno
people
de los
spend a certain period
principales
of time in our
problemáticas
facility.
que nos encontramos es que
One of the main
cuando
problems that we
nuestros chicos
have is
vuelven
that
a su
when they
entorno,
go back to their original environments,
es habitual que haya una recaída porque no hay un trabajo en esos
relapses are
entornos.
common
Por lo
because
tanto,
there's no
vemos
work has been done
imprescindible que
in
haya
their
dentro de esas zonas más excluyentes
home environments. So in that more
y de esos entornos
excluding
un
environment,
tanto
that
más
more
con menos recursos económicos
the less
y
resource,
educativos y
an
materiales,
area of
que haya
fewer
un trabajo
resources,
comunitario y un
economic and
trabajo en
material
red
resources. There needs to be community work. There needs to
para
be
que se pueda dar
network
continuidad a nuestra intervención una vez el
interventions so
menor
that there could
o
be
la menor
continuity of our
vuelva
work once the
a su
minor
entorno de origen.
goes back home.
Para terminar, sí me
And just to
gustaría
conclude,
hacer especial mención a lo que ha
I'd
dicho
like
también
to
nuestra
make special
compañera
mention
Valeria, a esa
of
corresponsabilidad
something that
social,
Valeria said, that social
que creo que al final
co-responsibility.
todas las personas
In the
que
end,
somos interventores dentro
all of us
de
who
la
work
infancia,
in the intervention
agentes
programs
interventores, podemos
for young
dentro
people
de nuestra parcelita,
within
haya
our
más
own
recursos
little
o
area
menos recursos,
of work,
podemos hacer un buen
no matter
trabajo
how much we have in the
y
way of
debemos
resources, we must work
responsabilizarnos
together and take responsibility
de educar en este
for
estigma
educating people
y
on
en
the
la autoestima
stigma
de nuestros chicos.
and working on the
Nos vemos
self-esteem of our
después
young people.
en la parte de preguntas
So
y
I look
muchas
forward
gracias
to
por
your
vuestro tiempo.
questions. Thanks for your
Muchas
time.
gracias, Mario. Muchas
Thank
gracias
you,
por tu
Mario.
explicación,
Thank you for
por
that explanation
ajustarte al tiempo
and for staying
y
on time so
efectivamente,
well.
tal como habéis dicho,
And
¿no?
as you've said,
Que las
it's
cuestiones de
important
adicciones y todo
to
lo que
remember
intersecta es un problema de salud pública y que nos
that addiction
interpela a todas las partes de la
problems
sociedad,
are
una
a
sociedad
public
tremendamente
health problem,
individualista,
which
no
involves
que el
all
bienestar de las
of society,
comunidades, de las infancias y
despite
de las
our
familias, pues es una cuestión que
individualistic
nos interpela
approach.
a todos y a
It's
todas.
important to
Así que
remember
muchas
that it
gracias
affects
por
everyone,
todas las
all families.
aportaciones y
So
por todas
thanks
las
to all of
presentaciones.
you for your contributions and for your
Te
very
voy a
interesting
pedir,
presentations. Now,
Mario, si
I'm
puedes
going to
dejar de
ask
compartir la
Mario
pantalla.
to stop sharing your
Muchas
screen.
gracias. Así
Thank you.
podemos encender las cámaras.
That way we
Gracias.
can
Y
turn
podemos
our
pasar al
cameras
turno
back
de
on
preguntas y
and
respuestas.
go on to
Tenemos una
Q&A.
media hora más o
We
menos
have half an
para
hour
poder cubrir las
to
preguntas que nos han
answer
ido
any
formulando
questions
tanto la audiencia como las
that
que
you've been
queríamos
asking.
recabar. Y vamos a empezar explorando
So
las
we'll start
preguntas sí que más dirigidas al foco
by
en el que se han
exploring
centrado Agnes,
the questions
Rebeca y
that are more
Valeria.
devoted to Agnes, Rebecca, and Valeria.
I'm going to read these questions for you, Rebecca, Valeria, and Agnes, and maybe we can cover these two questions, and then we will move forward to our friends, to Rajesh and Mario, to cover the other two questions that we have. So the first one is regarding strategies. What strategies do you consider most effective in reducing the stigma and emotional impact experienced by children whose parents or guardians face substance use challenges? I know it's a tricky one in a few minutes, but maybe we can just brainstorm a little bit. We want to break the ice. Agnes, okay, Rebecca, go on. Awesome, great. Feel free to just have the conversation.
Yeah, well, as I said in my presentation, I think it really needs a family-centered approach and a multifaceted approach, so from different angles, and to cover, we need to cover the needs of all the family members, the children and the parents. And as I described, we try to achieve that by one, focusing on collaboration and cooperation of different services, and secondly, on training professionals or developing the curriculum. We haven't trained based on this curriculum yet, but focusing on professionals in various sectors who all have some kind of contact with the families. So we're trying to address the families from all different angles.
Thank you, Rebecca. Thank you very much.
Yeah, I can, when I think about this question, and when I was seeing it, three things really come to mind, based on the work that we're doing and that we've heard as well, in addition to, what Valerie and Rebecca both had mentioned. So one, again, and I know I really focused on this, was not only centering lived experience, but really integrating it into the resources and the supports that are available, to having supports and resources proactively available, versus needing a person to reach out for them, because we know that stigma is too big of a risk and a barrier. And I'll elaborate on this, I guess, but really in ensuring, and I think that, this was talked about when we talked about the social determinants of health, and who is most at risk of harm when reaching out for supports. Individuals who are in poverty, who have experienced trauma, who meet those barriers and continue to meet systemic barriers to support. And so really ensuring that a public health approach is taken, which models how to support the well-being of people who use drugs. And I'll just elaborate, and Valerie, this was, you had talked about the relationships and that relational lens, and that's really the approach that we take as well. And we even go so far as to define stigma as the presence of harmful behaviors, beliefs, policies, and also the absence of protective ones that negatively impact the relationship individuals have with the current systems, with their community, with their family, and ultimately with themselves, right? That relationship, that shame, that blame that is carried on generationally. And so all of our trainings, all of our resources, all of our programs really aim to build that capacity of professionals and families to rebuild those relationships so that young people can trust the people and spaces around them to meet their emotional, but also their healthcare needs. And often that's modeled, and that blueprint is set by how our current system's supporting parents, I see as a young person how you treat my parent with the supports that you're offering or not offering. And so how can we really destigmatize these spaces and meet those emotional needs by having resources proactively available? Thank you.
Totally. Yeah. And how these tricky narratives that they force you to trust in the system, but at the same time you see that system is totally stigmatizing your parents. So it's almost impossible to do that. But at the same time, you're feeling guilty to do so. So yeah, thank you for pointing out. Thank you, Agnes. Valeria, ¿cómo vemos esto?
Sí, coincido con lo
What's your
planteado
opinion?
hasta ahora.
Yes, I agree with what the other speakers have said. I would also add that
ponerlo en agendas ya es
putting
una
it
forma de
on
empezar a
agendas
generar o
is a
pedir
way
cambios.
to begin to
Que los
generate
niños,
change.
las niñas y los adolescentes sepan
Children
que
and
hay
adolescents
lugares y hay
must know
espacios
that
donde
there are
pueden recurrir y pedir
places, there are
ayuda,
spaces
más
where they can
allá
go to get help
del rol del adulto a cargo
beyond
que
the
lo puede
role
hacer o no.
of the responsible
Por eso
adult
creo,
who may or may not be
en
able to provide
relación
help.
a la corresponsabilidad y conjuntamente con
That's why we
lo
try
expuesto
to
por Mario,
manage
pensaba
co-responsibility. And a
lo
bit
que
like
decía
Mario
Rebeca
said,
también, en que
and
haya
as Rebecca
espacios
said,
donde los
there must
profesionales
be
estén
spaces where
con la
professionals
escucha activa y
have
atenta a qué puede
active
estar
listening
pasándole a este
and
niño o
are
a esta niña
attentive
más allá de
to
las
what is happening
circunstancias
to that child
específicas de sus
beyond
lugares, ¿no?
the specific circumstances of their
Poder ser
home
receptivos a sus
life or
demandas, a
whatever the
sus
specific circumstances of the situation
padecimientos
is,
y a poder
to follow them,
pensarlos en relación
knowing
a su salud física y mental, en su salud
how
integral.
important their physical and mental
Y
health
de ahí poder ser
is,
adultos que contengan, que sostengan, que escuchen
and looking for containing,
de
sustaining,
problemáticas que pueda tener un
listening
niño o una niña, porque
sorts of responses to these children
problemáticos son una
who may be
consecuencia de muchas
going through
otras
problems
situaciones
that
que
are a
pueden generar
consequence
malestar, estigma
of situations that were not caused by them, but that can generate major stigma and stress.
Muchas gracias, Valeria. Hay una pequeñita interferencia con tu micrófono.
Thank you, Valeria. We had a bit of
O sea,
interference with
luego
your
podamos
microphone.
acercarlo un
Perhaps
poquito
we
más,
could
a ver si funciona mejor.
improve that a bit if you could.
Totalmente. Bueno,
But we
señalas una
fully
cosa que
agree
también es muy importante, ¿no?
with
De
your words.
cómo
And another very important thing
no
that you
solo
mentioned,
nos estamos
how
dirigiendo con
we're
esta
not
actividad de
just
sensibilización a
addressing
las
with this
profesionales
awareness
que al
raising,
ámbito
with this
de
sensitization,
drogas o adicciones,
professionals
por
who work
llamarlo de
in
alguna manera,
drug or
sino
addiction
aquellas
care,
personas adultas que
but
puedan estar en
all
contacto
the
con infancia,
adults
¿no?
who
Esa
may be
mirada,
in contact with a
el
child, no
sentirse
matter
visto
the
y
scenario,
vista, el que
and
sean
the
vistas
child
las
has to
infancias
feel
y
seen
escuchadas,
and listen
no solo
to,
diciendo que no es
not just
estigmatizante, sino
by
también haciéndolo con
saying
nuestra mirada, con
there's no
nuestra
stigma,
corporalidad, con
but
todo
conveying
nuestro
that
lenguaje, ¿no?
with our body
Entonces,
language, with our
por
look,
aquí también
with
podemos
all of our
profundizar de qué
communication.
pasa
I
por la
think we could
sensibilización y las
work
formaciones
a lot
vivenciales,
more
¿no?
on that
Vamos
and
con una segunda pregunta y luego
understand more
pasamos a
about
los
how
compañeros.
we convey everything we convey. Next
What
question.
role can community organize? I know it's another tricky one question, but we have a lot of civil society audience today, and maybe they want to hear a little bit more about what can be done, what can we do from our roles in day-by-day activities. So the question is, what role can community organizations play in advocating for and protecting the rights of children affected by their parents' substance use, affected by the stigma and the shame around their parents' substance use, to be more precise, and in supporting families with compassion, solidarity, and overcoming stigma? Very complicated questions, I know, just in a few minutes. Valeria, go ahead, please. Thank you.
Sí, resaltar en parte lo
Yes,
que comentaba en la
I would
presentación y algo
emphasize
que
what I said in
Héctor
my presentation,
en el chat de
how
preguntas también
this has
planteaba,
also
¿no? El
come up
lugar de las
in the chat.
organizaciones de la sociedad civil
Organizations in civil
es fundamental,
society,
es crucial porque
we have
estamos
to
en
tell
la
them it's
base de lo
fundamental
comunitario, estamos en el
because
contacto
we're at the
directo
very
con las
foundation
comunidades,
of the
con las
community. We're in
personas,
direct
somos
contact with
casi como
communities and
el
with
primer
people. We're almost
escalón
like the
para poder
first link in
acceder
the chain
a ciertas problemáticas y a poder
to
favorecer
access
de alguna
certain
manera el
problems
acercamiento
and favor
a la
a
orientación y al
closeness
acompañamiento, con lo cual
to
me parece
guidance and counseling and
muy
accompaniment.
importante este trabajo en red
This
en
work
función de poder motorizar a
in a
otras
network is
instituciones
very important
más formales y más
as
burocráticas o
we
con
can
otros requisitos de
work hand in
accesibilidad
hand with
a que
other
puedan
stronger, more
tomar
official
y realizar acciones
organizations
en función de esta problemática, ¿no?
for
El
them to
bajo
take their
umbral que
actions
plantea
on the
muchas
problem.
veces en la accesibilidad una organización de la
Oftentimes,
sociedad
the problem
civil
is one of accessibility.
facilita
civil society organizations facilitate people, children or their families, to be able to access other more formal organizations, and otherwise it would be very difficult to get their attention. That's why it's important to have, especially territorial organizations, people who are very integrated into their communities, places of the greatest vulnerability, to be able to work closely, to go beyond these borders of an institution and go out into the community and seek the problems out and not wait for them to appear at your doorstep. That's something that we need to begin working on and to promote.
Muchas gracias, Valeria.
Thank you for that, Valeria.
Acabar la traducción. Agnes, Rebecca.
Agnes, Rebecca.
Yeah, I can jump in as well. Thank you, Valeria, for that information, and I'll piggyback on that and just share a little bit. You know, the two things we hear the most, one from organizations is no, young people aren't bringing this up. They're not wanting to talk about it. They're not bringing it up. They're not bringing it up at roundtable discussions on youth mental health. They're not bringing it forward in counseling sessions. And then on the flip side, what we hear from peers with lived experience is we can't reach out because we are fearing shame and discrimination. We are fearing our parent will be criminalized or will be removed from our home. And so the first question I always ask organizations is, can young people share with you that their parents are using drugs, that they're afraid for them, that they're caregiving for them without fear of being shamed, of criminalization, or being removed from their home? Because that fear is very real and prevents young people from reaching out. Also in that video that I shared of the survey we did where we had more than 200 participants respond, you know, what wasn't identified in that video was, you know, people didn't reach out because of shame and stigma. They also didn't reach out because they didn't know where to find resources or there were no resources available. And that was about 30 to 40% of individuals had identified that. And when we think about the millions of young people who are growing up with parental substance use, we should have resources and supports proactively available because, again, stigma is too big of a risk and a barrier. You know, in that survey, 70% of people said that they were caregivers for a parent. So they were taking care of a parent, but they couldn't tell anybody that because it was too risky. And so we've built a toolkit for young people saying, hey, when you're a caregiver, this is what helped us, right? When a parent's withdrawing from alcohol, when you are having to be responsible for kids, right? How can we validate these experiences and actually give tools that are based on their lived experience within that? You know, we're talking about children's rights, and the UN Convention on the Rights of a Child, they're interpreted very differently where we look, right? Young people have a right to be protected from harm. So many children are removed from their parents, but they also have a right to not be discriminated against. They have a right to information and to heal. But young people can't reach out, right? So I think the biggest role I see community organizations playing is meeting those emotional and healthcare needs that address those social determinants of health and that allow a young person to talk about it, to have their experiences validated without fear, because that fear is really limiting people from reaching out. And then the resources available.
Probably that's a very appropriate question to do ourselves as a professionals, if they can speak out without any fear. We invite all the audience to have these questions about their own institutions or organizations. That would be very nice. Thank you, Agnes. Rebecca?
Yeah, well, I'm working for a huge public body, so quite the opposite of community-based organizations.
That's awesome.
Yeah. Yeah, but I believe that we actually need those organizations to fill the gaps that we can't really fill ourselves, or where like healthcare and addiction services can't fill. So yeah, I think like that those organizations can often much better advocate for children's rights, work to reduce stigma, or directly work with the children themselves. And we have actually made very good experiences with an organization in the first Make the Difference project with a German mentoring initiative called Baloo and You, which pairs children with trained mentors, young adults basically, who provide consistent support for those children. And yeah, we have made great experiences with them. And I think this is just like the right addition to the things that we can offer with our organizations.
Thank you very much, Rebecca. We certainly have a lot of different questions for you, but we are running out of time. Just a very quick one comment. Christina von Sperling from Carincama Freedom Welfare Foundation. How can LWL collaborate in professional training in Pakistan or share the curriculum or materials for consultation? Maybe this is an invitation for collabs, and we can put together in touch. That would be awesome. And we have like a few questions that it could be for all of you. So let me just ask Rajesh and Mario a few questions about the intervention models, and we will come back for the whole group. So the next question is for Rajesh and Mario. In your experience, what are some of the most significant barriers that children and young people face in accessing age-appropriate substance use treatment? And how could these barriers be overcome? Again, very difficult questions, I know, but maybe share some quick ideas on that.
Okay, you want me to first speak or?
Yeah, awesome. Rajesh, Mario, just go ahead, whatever you want.
See, again, from our experience, if the services are not there, whether you generate demand or demand is generated by the family means nothing. So again, the model what we have developed in Delhi, there are 6 hospitals in Delhi. Those who are now, they have dedicated X number of beds for the children, those who are dependent on substance use, and one is dedicated for girls. So that is one. So service provision is the first thing. Like chicken and egg, the same thing is here. Number 2, who are the people, those who will try to access these services, and who are the catalyst? For example, we have a committee called Child Welfare Committee. Any child who is in trouble will be sent to the Child Welfare Committee. So we have been training Child Welfare Committee members. There are 3 or 5 members in that committee. If they have been trained how to identify a child who is suffering with a drug or mental health, so then the first thing I said, don't worry, send it to them, to us, and we will assess whether they need any support or not. So similarly, the children, those who are in conflict with law, there is a board called Juvenile Justice Board, JJB. Similarly, what we have done for the rural area, what we have done is we are now sensitizing Panchayati Raj. We have three tier of governance. One is a federal government, other is a state government, and third at the village level. So we have developed modules to train the elected members of that the village, and the outcome is very positive. The whole idea is that they are your children. It is your responsibility to protect your child. It is your responsibility to ensure that the drug traffickers and bootleggers do not enter in your area. And there are 2-3 big services for the children. We call it ICDS, Integrated Child Development Centers. Now these centers are there in every 5,000 population. So we have also trained them, because they are the first contact for the local the women and the families. So these are the people. And then what we tell them, that if you cannot come, don't worry. Your local NGO, just give them our number and they will call us. So it is a escorted service what we try to provide. Otherwise, a child who has been diagnosed with the problem, and if we do not attend, then we lose the credibility in that community. So it is end-to-end program, and we have documented all this, and we keep training civil society organizations. In fact, today also we finished one training of 3 days. Peer educators, those who are working with HIV/AIDS program. So we keep doing this, and we are, again, initially what I said, we are developing only models, and the models what we develop, we give it to the Government of India, and then Government of India would like to implement in different parts of the country.
Thank you very much, Rajesh. I'm wondering if maybe our next webinar should be emerged from professionals' welfare services, and maybe have this conversation all together, how we all see it, non-stigmatizing intervention and having resources available. I don't know if Mario might want to add something. We have a last questions, and maybe you can all participate in this because it's a very broad one. how can health and education system be adapted to provide a better support, focus on the rights of children and adolescents facing challenge, because of their own substance use or their parents or these different situations. We were talking about the social determinants, restrictions, and so on. Maybe we all can share how can health and education systems can be adapted, they can improve their intervention. Do you have some idea? Maybe we can share some quick ideas, not just big, because sometimes excuses, we have no budgets for this. So go on. Thank you. Raj, you're muted right now. Maybe you can.
So, I'm so sorry. So you see what we have done with this module Navchetna, what was developed, 3 years time. So now this is a school-based teacher-led. So any other organization's role is minimum. So a school is on board, the teachers have been trained, and teachers have been provided all the information, whatever is required. And then we also provide them the services available for the children. Only request is don't announce name of the child publicly. So this is something and which is working. Like, in one small district near Delhi, we trained around 1,000 teachers. And by now we have received more than 22,000 children's issues. And some of the issues were not substance use or mental health. But somehow, we try to address all those. So this is one thing which is a school-based, education-based. But again, for this, what we need is a government. Whether it's a local government, whether it's a national government, they have to be on board. Otherwise, we will able to reach out 10, 15, 20 schools and that's it. Thank you.
Thank you, Raj. We invite all the audience because we know that there's so many people attending today that they do local activities and local programs in this line. So we share together these good experiences. And Agnes, Rebecca, Valeria, just go and you want to share. How can we improve these systems?
I'll just lean on to what we're doing. We're providing resources, again, peer created toolkits and resources that allow a young person to say, hey, I see myself reflected. Somebody understands, I'm not alone. And then our peer mentorship program. And so we're allowing young people to navigate through their story, make meaning of their experiences, both within the context of their family and home environment, but also the systemic barriers that have affected themselves and their parent. And so I'll lean in on that, on the lived experience that we're using through our resources and our peer leadership program.
Thanks, Agnes. Let me just a little bit. Do you have any recommendation that do's and don'ts in their peers intervention? Because we have a lot of different examples, but not all of them are working.
Sorry.
Regarding the do's and don'ts in when designing and implementing this peer-to-peer intervention, like non-stigmatizing, because your materials are awesome. So many people can see themselves in that.
Absolutely, yeah. So I would say the first do, and an example, we have a lot of researchers that come to us and ask, how can we get more participants, or how can we co-develop resources? And at the center, if you don't have somebody with lived experience, it can be very, very harmful. And so I would say, do bring in somebody with lived experience. Do bring that in just to soften and build that relationship. 2, take time. I always say we talk about empathy and compassion. Empathy is being able to understand other people, but we need time to understand and build that relationship. And certainly don't villainize parents. A lot of resources right now, they talk about the harm of a parent. They talk about parents in a negative light. They talk about parents are bad for using drugs. And although young people and any peer can say, yes, I experienced harm. I was angry. I was upset. When they hear that their parent is bad, young people are going to see themselves as bad as well. And it's going to discourage them from seeking out or trusting that resource. And so I take pride in our resources, Gisela. Thank you for always sharing and and chatting about them. We have parents who have addictions, who ask for our resources for their own children. We have parents who are in treatment, who come to us and pack our hope kits with their children to say, this is somebody who also grew up in a home like this. And so the biggest thing is create those resources and supports from that lens of lived experience, and do not stigmatize or blame or shame a parent, because that child will see themselves reflected in that.
Thank you, Agnes. Thank you for these important insights. And Valeria and Rebecca, we are bring it to an end in our webinar.
Sí, creo que me parece importante
I
trabajar con
think it's
los
very
educadores,
important
con las
to
escuelas
work
en el
with
sentido
educators and
de
schools
que
because
son modelos de
they
identificación
are models with which
diferentes
young people
adultos para estos
identify.
niños y niñas que
They're
tal
different
vez
adults for these children who
no cuenten
may
con entornos que
not have
favorezcan estos otros
the
modelos,
most
¿no?
favorable
Nosotros en uno de los
environments
dispositivos
to find
de
role models.
infancias que tenemos,
One of the goals that we have for our children
niños y niñas que provienen
is
de
that
espacios
we
y de
take into account
lugares,
that
de
there are boys
contextos
and
de
girls that come from
mucha
places
pobreza,
with great poverty,
donde realmente
where
encontrar modelos de proyectos de
finding
vida
role
diferente a
models
eso es
and
muy
life
difícil, y
projects that
entonces
are
uno de
different
los
from that
objetivos que
is very
perseguimos
difficult.
en el
One of
dispositivo
the
es
goals that we
justamente
seek in our
trabajar
model
la subjetividad,
is to work on
trabajar la
subjectivity,
potencialidad de cada uno de
work on the
estos chicos y de estas chicas,
potentiality of
movilizar
each of
su
these
deseo
boys and
y
girls
qué
to
les
motivate
gustaría
their
hacer a
desire,
futuro y que
what they
tienen
want to be when
todas
they
las
grow up,
posibilidades de poder
remind them
serlo,
that they
¿no?
have every
No
possibility to
tienen por qué
become that.
repetir historias,
They don't have to repeat history,
ni tampoco
nor
tener que
do they have
siempre estar
to
a cargo de otros o al
always
cuidado de otros más
be
chicos, que esto es algo que
someone
también
else's
se da
responsibility.
bastante habitualmente. Creo que poder dar el espacio de ser
Keeping
niños
a
y
space for
niñas
that,
en
for them
estos
to be
espacios es
boys and girls in these
sanador,
spaces
es
is very
terapéutico,
healing.
y por
It's
otro
therapeutic.
lado, como decía Agnes,
And as Agnes was saying,
saber que vienen de adultos, de padres y de
knowing
madres
that
que
they
han sido
come from
niños muy
adults,
probablemente
mothers
con
and
traumas,
fathers who have
con
been children
situaciones de
who
mucha vulnerabilidad
themselves
social
have
también,
felt trauma,
donde su lugar
problems,
de hijo
vulnerability,
ha estado
their role
tal
as
vez
a son or daughter may have been
posicionado en un apego inseguro, donde no han
insecure
tenido esta contención necesaria al ser hijos,
without
entonces
the
al ser
necessary
padres uno muchas
containment.
veces repite esta
And
historia, con
so
lo
when you
cual
become a
el
parent, you often
estigma, la
repeat that history.
discriminación
So stigma, discrimination,
y el sesgo no hacen más que seguir
and bias
revictimizando
just
a un grupo
re-victimizes
familiar que
a
necesita poder
family
pensar
group
en otras
that
alternativas.
has to be able to think of other alternatives.
La mirada compasiva, ¿no? Que ha salido
A
tantas
compassionate
veces en todas
outlook that
las
we've heard so many
intervenciones,
times
profesionalidad y
in
compasión que van de la
these
mano, no son
interventions,
cuestiones
professionalism
opuestas.
and this outlook,
I'm
which
sure
go hand in
Rebecca,
hand.
if you want to add something in the last minutes. Regarding this last question. Okay, we have Mario who are with us. He is struggling a little bit with connection. We have a very stormy day in Spain today, so our connections are kind of weak. So I'm not sure, Rebecca, if you want to add something to the last questions, or maybe we can go with our main takeaway, our last main takeaway. So Rebecca, go ahead, and then we can go with this inspiring last sentence or the call to action.
Yeah, well, I just wanted to say, like in the field of education, that like the curriculum we have prepared, one focus is the sector of education. So we recognize that teachers, they are seeing the children every day. They have a great chance to support the children if they identify them, if they see them, if they recognize their needs. So teachers should be like a great focus for us. And another thing is that at least here in Germany, we are spending a lot of resources into universal addiction prevention in schools, which we don't feel has the greatest effect. So what we here in our department want to promote is like to either focus on selective prevention, so support or identify young people who have a need for support and to put resources there, or rather focus on more a general approach on preventing mental illnesses overall in schools, and not just focus on universal addiction prevention like we do here in Germany. And I really want to support what Agnes said, to bring someone in with lived experiences, like in all our different projects where we have succeeded in including people with lived experiences, young people who use substances mostly. This had brought so much better results and impact to our products and projects. So yeah, I really wanted to to stress that again.
Thank you very much, Rebecca. Thank you very much. I'm so sorry, but we run out of time. It's super interesting, all the intervention, and I'm pretty sure that everyone could be 2 hours more. So I would like to invite you to if you have a last idea or thought, a very short, a very brief idea that you want to stress out before we are leaving today. So please feel free, and the floor is yours. I have to say that we have plenty of questions in our chat box, and we will not be able to cover it, but we are certainly will meet up again for this. So, any last takeaway today?
I'll just say thank you very much for hosting this and for everybody who's here. This work is so important. It matters. You know, we've heard from people around the world that this is an issue. And I'm just really grateful that this conversation is happening and that voices of young people, parents, professionals are coming together, because that's really where the strength is in people coming together and saying, this is an issue. We have our political beliefs. We have our moral, identities. But this is an issue, and parents and their children need more access to resources and supports. And so thank you, Dianova, and everybody else here just for initiating these conversations and creating a space where we can talk about this.
Thank you, Agnes. Go on, please. Yes. Yeah, Rajesh.
Dianova could be a platform. You can create a platform of the good practices, the learning, like what the Germany has been sharing. So you can collate it and share with us, and it will be easier for us, especially for the countries those who are coming from South, to learn already the experience and understanding. And another thing is how to handle social media, because the young population, we just don't know how to enter in there, the area. So, again, help us. I know you have been developing, Dianova has been developing a campaign. So, but then you have to help us on a train us how to reach out to young population. See, I have no social media platform except WhatsApp. So help us. Thank you.
Thank you, Rajesh. We take note. We have homework to do, of course. Thank you for that. Rebecca, Valeria, any final thoughts? Everyone is saying
bueno,
thank you. Thank you so much on the chat box for you.
Me parece que estar hablando de esto y poner en agenda.
Thank you. It's very nice to be able to talk about this and to put it on the agenda and raise awareness on the fact that there is a problem that requires our attention. Whenever we talk about young people, we have to remember that what we do today will have clear repercussions in the future of humanity. So our children should be our highest priority. They should be on our political agendas as of right now. Part of the work of organizations and civil society is to have an impact on public policies, public children's affairs policies in all our countries. And so it's time to revisit the UN Convention and remind ourselves of all of the commitments that are established therein. Okay, Rebecca.
Rebecca, no sé si me escucha, una última idea.
Rebecca, do you have any final ideas, if you can hear us?
Yeah, sorry. Well, yeah, from my side as well, thank you for hosting this. So that's just a great opportunity to get out the word. And for us, we had to find actually key messages from the project group. So first of all, what we believe in is that the safety of the child is always the first priority, should always come first. So that's like the most important issue for us. And second of all, like pay attention to the child, not just on the parent, and focus on the child, see it, recognize it. That's
Thank you very much. Thank you very much, all of you, for your time, your effort, and sharing all your knowledge. Now we have reached to the end of this seminar, and it has been an honor to share this space and hear from you. And for a very active audience today, actually, a heartfelt thank you once again to our speakers. your time and effort in the organization of the event, preparing your presentations and sharing your invaluable expertise to inspire collective action is very deeply appreciated. It wouldn't be possible without you. Your contributions has been instrumental in making this seminar a success, and we are truly grateful for the insights you have shared. And a special thanks as well to Patrick, our interpreter, and to the ANOVA technical team, Gerard and Pierre, for their crucial support behind the scenes. And of course, a big thank you to every one of you for your active participation in the chat box and the Q&A box. It's been awesome. I also encourage you to stay tuned for the upcoming events, including the next one on Wednesday 20th, titled From Commitment to Action, Civil Society Experiences in the Fight for Children's Rights. So let's continue to build on this momentum, advocating for the rights of children, supporting organized civil society efforts, ensuring the protection and accompaniment of families, and working toward a future where childhood and families are free from stigma, discrimination, and violence. Thank you so much again, and I hope you have a wonderful rest of the day. Thank you.